Thanksgiving.
I did. I hope the same for you.
Yeah, it was good.
We know, Lucina, we know it's always good because we saw you on Facebook.
Doing what? I was on Facebook for Thanksgiving. Probably my son, not me. I was too busy cooking for 25 people.
Right.
All right. It is 10:01, so out of respect for everyone's time, we will get this meeting started. The numbers look a little bit low for now, but I guess that's expected coming off of a nice Thanksgiving break. So hope everyone had a nice Thanksgiving for everyone that celebrates, and if you didn't, hope you had a good few extra days off. I just want to quickly kindly remind everyone to please be respectful of presenters and speakers. If you have specific personal issues or concerns, please reach out to myself, Rochelle, or Marjorie on the side or privately after the meeting or even during the meeting on the private chat. And we can try to assist and address any issues you may be having. And just to get started, I'll pass it over to Rochelle to introduce our special guest presenter.
Thank you, Brian, and it's good to see everybody this morning. It's my great pleasure to introduce this morning's speaker, the Honorable Kim Hill, Chief Disability Officer for the state of New York, who is here today to speak about employment for people with IDD. Governor Hochul appointed Ms. Hill to this new position in February of 2022, and she and her team have been extremely busy since then and working to break down silos between state agencies and really represent the interests of people with disabilities in policymaking for the state. She has a very long resume in disability rights and advocacy. She served as the Assembly Standing Committee on People with Disabilities as their principal analyst and was the director of the Assembly Task Force on People with Disabilities. She also worked to pass bills related to the state's Medicaid buy-in program and the nursing facility transition and diversion waiver, which is very important for people in our community. She helped develop and now chairs the most integrated setting coordinating council, the MISC, as part of the ongoing effort to break down divisions and lack of coordination between state agencies who serve people with disabilities. I am going to ask people, Ms. Hill is only available until 10:30, so it's a short time. So if you will please put your questions in the chat so that she can address them effectively during this discussion. And with that, I'll turn it over to you, Ms. Hill.
Thank you so much. Thank you all for having me here today. I hope everybody had a great Thanksgiving and a good little break. I actually took 4 days and did not open my email, and I'm regretting it a little bit right now, but I hope everybody enjoyed their time off. There's a number of initiatives that I wanted to just touch briefly on as far as what we've been working on since the governor created our office and in terms of employment. And I think the first thing that I have to mention, I'd be remiss if I didn't, is the governor's creation of this office. The way she did it, not only did she staff it, which is a huge component of allowing us to be successful, but she also put the actual existence of this office into state law, which means that it would be much harder for another governor who comes along to be able to swipe it or ignore it. Can't say that it couldn't be done, but it would make it a lot harder. So in any future administrations, there still should be this protection and coverage for the disability community in New York. I think what got us started as quickly and as robustly as we did on employment was the governor's remarks when she created the office. On the day that she appointed me and signed this office into law, she was very, very clear that employment was. I'm sorry?
I know.
Oh, I think there's somebody on mute.
Eleanor, can you please mute your microphone?
Where or when?
Eleanor Block, please mute your microphone.
Why not in the apartment? How many people are you inviting? What?
Can you guys mute her?
I can't hear you.
Eleanor, mute yourself.
Oh, there we go. Okay, sorry. Okay, so anyway, when she created this office, she was very, very clear that employment was one of her absolute top priorities in general, but really focusing on the employment of people with disabilities. She stated that she wanted to add an additional 1,200 people to state employment right off the bat. And it was very quickly apparent with conversations with her that this is where she wanted to put a lot of her focus on this office. So immediately upon taking my position and hiring the team that I have, we have done a tremendous amount in the space of employment. And those are the things that I'm going to touch on today. So first of all, I'm assuming that some of you guys, if not all of you, are aware that Governor Hochul signed Executive Order 31 this past July in celebration of the Americans with Disabilities Act. Executive Order 31 commits New York State to being a model employer. And there's a number of measurable goals and initiatives.
When?
Thank you. A number of measurable goals that we put into the drafting of this executive order so that it actually has teeth, and we're going to be able to monitor what the state agencies are doing and also be able to tell how successful they are in the plans that they are now required to develop in the effort to hire people with disabilities. The executive order also requires our office, in conjunction with a few other state offices, to develop a number of trainings for all state employees. Some have to do with back-end website accessibility. Another one has to do with just disability etiquette in general. And then another one will be more specific towards hiring managers, so that people have a better sense of how to communicate with people who might have different types of communication disabilities, know what to expect, and also to make sure that in general, that they have the understanding that usually in order to onboard somebody with a disability, that their fear is that the costs are going to be too high. And in general, it costs less than $500 to bring on an employee with a disability. So if we can be educating our agencies along with requiring them to develop this plan, we're hopeful that this executive order is going to get us quite a ways in at least the advancement in numbers of people with disabilities working in the state. That said, we are also going to be working with a number of public employers, both very large and very small. We're lucky that New York State is so diverse in the types of employers that the state attracts and maintains. So we have already developed relationships with several of the larger.
The sound on. I'm trying to join a Zoom meeting. Do you know how I get the sound on?
Several of the larger companies that call New York State home, and we're also talking with some of the mom and pop businesses that are doing a lot of great things to hire and attract people with disabilities. Another thing that we are getting very close to being ready to do is the launch of the Partnership for Inclusive Internships. This is based off of a very successful program in New York City that you guys may be more familiar with, just being from downstate. But this organization was one of the first to reach out to us when we came on board. And as soon as we heard of the amazing work that they're doing down in the city, we asked if we could partner with them to launch it statewide. So we are in the process of looking for an internship coordinator. Once we hire that person, that program will be launched. So just a little side note, I do believe that job has been posted on the state job search site. So if any of you know of anybody that might be good candidates for that position, it will be in Albany, but please encourage them to come our way or find the link themselves. We can either help them or hopefully start seeing some amazing resumes. What this inclusive internship program is going to do is connect people with disabilities from a variety of locations. We've created partnerships with SUNY, CUNY, and the Commission on Independent Colleges and Universities so that we have a regular pipeline of students with disabilities that are looking for internships. The other thing that we're going to be working on is collaborating with all the not-for-profits that work with individuals with disabilities to see if they have interest in these internships. This internship program is a lot more flexible than the ones that would go through a traditional college program. It's not based on semesters, it's based on the number of hours. It can be full-time, it can be part-time, it can be very flexible. So we're hoping that this is going to significantly help us bring in people at the entry level and also therefore start utilizing the 55B and C programs, and for you guys down in the city, the 55A programs in a far more frequent manner. Oh, there's a couple questions on this. So the internship agency, there really isn't an agency. Like I said, it's going to be a partnership between the New York City office that is run through New York State HRC, I constantly get their acronym wrong. So in the city, it's run through them and the local Department of Social Services. In New York, it's going to go through our office. The internship coordinator will be housed here, but he or she will be making the connections with all the state agencies. Initially to start in Albany, but we've already expanded it to the city. So if there are state agencies housed in the city, the New York City people are working on trying to fill those offices with internships as well. So it's really going to be a lot about connecting the right person with a disability with the right type of job within the state agencies. We're looking for agencies that have a real desire to have this type of internship program going on where it isn't necessarily tied to a college semester and can be more flexible. So the question of where can people apply, I think if you reach out down in the city, you can talk to them now if it's someone that is city based. If it's someone that would be anywhere else across the state, you're going to need to wait until we have our internship coordinator, and then it would be more linking that person to the coordinator. Okay, next initiative. We have expanded the 55B program with our Department of Civil Service. There used to be 1,200 entry-level slots for people with disabilities. There are now 1,700. We're also working with civil service to do a number of things to enhance the 55B program, to promote it, to make it easier for people to get into it. And we're looking at other initiatives within the Department of Civil Service as well to get more people with disabilities working. Our office is in the final stages of reinvigorating what was once back in 2013 called the Interagency Coordinating Council for Services to Persons Who Are Deaf, Deafblind, and Hard of Hearing. That particular subcategory of people with disabilities in New York State has gone completely unrepresented in New York, pretty much ever. So our office is resurrecting this office. They are also going to be housed within our office, and they will be working on a number of initiatives, one of which will be employment for anyone that has any type of hearing disability. And that should be up and running by the beginning of the new year, is my suspicion. Our office has also created this public-private employment work group where we are working with a number of the state agencies that you all would expect. Anybody that has anything to do with the employment or providing services for people with disabilities, and also with some of the bigger statewide employers in New York State, to further our conversations about reducing the silos. And it's already been very much an effort where we're seeing success. We see agencies talking within these monthly meetings that we're holding, and they're also talking amongst themselves separate from the meetings that we are holding, which is very helpful because there's, I know you guys know this probably more than anyone. Many of our constituents have disabilities that cross agency borders. And we need these agencies to be talking to each other when services are being provided to make sure that an individual is getting the full round of services in order to both live and hopefully work successfully in New York. The Employment First Commission in New York that was established in 2014. We are working with the agencies that had a lot to do with that back in 2014 and trying to take all of the amazing work that they established and started working on prior to the pandemic hitting us and kind of bringing it back to the forefront, both within the work that we're doing with this public-private work group and the Executive Order 31, but also within the work that we do with the Most Integrated Setting Coordinating Council. We have an employment subcommittee on that. So as we move towards hopefully an Olmstead plan in 2024 being set forth in New York, that there's going to be many criteria and recommendations within that plan that have a lot to do with employment. And the Employment First Commission is going to be very helpful in setting those goals and parameters. For those of you who are not aware, right away when we came on board, we created what we call our Dream Symposium. It's a take on the NDEAM Employment Awareness Month in October. But what we wanted to do is make sure that the rights of people with disabilities are always discussed within that month, because there's a lot of our individuals who can't even dream of working without having the right kind of home care or direct support care or housing or transportation. There's a lot of components that go into getting a person to the point where they are ready to work. And so we turned it into Disability Rights and Employment Awareness Month, created a symposium. We hold it usually, so far, it looks like it's going to be the first week in October of every year. Each year, we're trying to add more and more components to the day. This year, we brought in a fun component by adding in some Special Olympics athletes who had a very robust competition with our agency commissioners, which was a lot of fun to watch. But it was also amazing to see exactly how much the component of sports and entertainment and being out and being a part of our communities and being a part of something bigger than yourself has to do with making an individual whole. And it was really, really fun to watch the athletes interact with both the commissioners and just other attendees of the event. We're hoping to make that bigger next year. We added additional workshops. There were 4 the first year. This year we had 6. This year, thank God, the pandemic was over, at least enough for us to have our job fair in person. 2 years ago, the Department of Labor hosted it virtually. But this past year it was held in person, which was amazing. Hoping to very much build on that in the coming years. And we're also hoping to add additional days to the event as we grow as well. A couple of the things in the background that we've been doing, and then I'll leave this open to some other questions. New York has been applying for a number of federal grants that have to do with the employment of people with disabilities. We have won first rounds of the federal NEON and Aspire grants, and we are now on to the second round in NEON. And these are just acronyms that kind of differentiate the different grants that we are focusing on. There's one that focuses on a collaboration between OMH and Access VR, and that's Aspire, and the NEON grant is a larger consortium of agencies looking to really move the Employment First Commission goals and recommendations into future years and not only continue in the recommendations and goals that were set forth in Employment First, but to continue moving forward and reestablishing and creating new initiatives and goals. And employability, I think that is the last thing that I did want to touch on. OPWDD has an employability pledge. They encourage businesses in New York State to sign it. Over the course of the next year, we are looking to put some additional teeth into that employability pledge, some training, and there is a toolkit available for businesses that need some assistance with the help in building their own plans in hiring people with disabilities. So I think that, yes, I have covered a majority of the initiatives that we are working on. I have some, I think we have 10 minutes for some questions if you guys want to open it up. And I can also, while we're doing that, read through some of the other questions.
Thank you, Kim. So just to help you, there's a couple of questions in the chat. So I was just jotting them down because
Okay.
I know people are making announcements too. So Carrie from the Brooklyn Library just stated that they would love to host interns if you're looking.
Fantastic.
So we can always provide you with her contact information as well as it's in the chat. She's part of Inclusive Services at Brooklyn Library.
Okay.
And then the second question I saw was, will internships be paid or unpaid?
Oh, thank you. Good question. They are paid. This is a partnership that, as I mentioned, we will always have like our not-for-profit partner, but Access VR and the Commission for the Blind are two partners that pay the interns. And then the Department of Labor is one that jumped in, and they are funding the statewide internship coordinator. So yes, they are paid for the interns, and the Department of Labor has become a huge friend. So I have to give them a shout out, not only in the fact that they host our job fair every year and do a tremendous amount of work monthly with us in our public-private work group, but they have very kindly offered to pay for this position.
All right. And we do have a couple of people with hands up. Christopher?
Good morning, Kim. This is Chris. It's good
Hi.
to see you again, since we
Good to
met
see you.
at the moped again. I was really impressed when I was hearing about you mentioning transportation, and I do want to thank you on 3 hats, because a lot of the people have been hearing you a lot for the last year, how you've been working with all types of disabilities, even down here, and I know it's not been very easy. Oh, regards to your husband, I hope his feet is doing well. That's one thing I didn't want to forget. How can we, and I'm going to say, because there are both councils here, the advisory and the DD, how can we work together to accomplish even more? Because I have seen a lot of your information on our website, which I'm looking right now, and we do share it, and I do try to share it when I do get the information from Brian and I both, and Rochelle, I'm sorry, Rochelle, back and forth, sharing information to everyone. So how is you guys having newsletters and anything?
You know, these types of things are the things that like are on our list of we would absolutely love to do. If there were only another 2 days in the week or more hours in the day. So really good question, good suggestion. On the newsletter itself, we do try to keep our website as updated as possible. The newsletter itself, that's something that we need to, just a little bit of a backstory. I'm not fully staffed yet. By the end of the year, aside from the Inclusive Internship Coordinator, I should be fully staffed. So hopefully our bandwidth will widen at least a little bit. But anything that has to do with anything in the communications realm, as you can imagine, we have to go through a number of different offices. I'm not sure, because the way that we are housed, the way we're created through the legislation, our office is part of what is called the state operations portfolio. We are unique in that we're far more public facing than any of the other portfolios. They're more internal staff for the governor, where our office kind of does both. We're kind of like a constituency group, but also a policy group. So we're the only one in chamber that does this in the state operations portfolio. So we're trying to feel our way through what we're able to do in state operations. Once we are fully on board, I'm hoping that we can be far more engaging in that way. I'm hoping that we can have a newsletter. I'm hoping that our social media can exist. But it would be independent of what the governor's team is putting out. So these are all things that it's still a relatively new office. So yes, in theory, I hope that there's going to be far more information coming up, but it's still going to be a little bit of time.
Thank you.
Thank you for the suggestion.
The next person with their hand up was Deborah Greif.
Hi, good to
Hello.
see you again, Kim.
Good to see you.
Kim, I'm going to talk as a parent. Everybody's very excited for people with disabilities to go to work, except they forget about if they don't report or work with their benefits correctly, they lose everything. So
You know what?
I had that happen to my child because originally the work program for OPW said it was a stipend when it was a wage. Thank God everything was in writing, but please want you to understand that a lot of times parents and their care managers, because they used to be MSCs, don't understand that what you make has to be reported to Social Security, whether your child is on SSI or SSDI, and they collect under their parent's Social Security. They can't make $1 at the moment more than their parent, and they lose their Medicare, Medicaid, but they lose their waiver and the coverage for the Part A and B. So that's pretty serious. Please understand, I'm not against people working, but all of a sudden, I have parents who've called me. They're paying every month on their credit card their children's services so they can work. I don't think that's a great idea. So I hope you understand what I'm saying. Will you be happy?
To some degree, I do, although I would really appreciate probably a separate conversation, because
Sure.
I feel like I might need to be educated a little bit more on the whole parent side of things. And I completely forgot my biggest thing that I should have mentioned that will help some of these individuals, but I don't necessarily think it would help in what you're saying. The Medicaid buy-in expansion in New York State that we were able to get through this year's budget, something I expected to take 5 to 10 years. We were able to expand the Medicaid buy-in so that people will be able to earn up to $615,000 a year. And there will be a sliding scale that people do pay into, but it's fairly based on how high your income goes.
Oh,
So-
excuse me, Kim, that's not what I was saying. What I'm saying
No.
is,
Yep, and I understand that. I just wanted to make
Okay.
sure that people did. That's why I said I think that this is separate for what you're talking about. But
yes.
we do understand the
Mhm.
situation of benefits and people being fearful of going to work. And the actual situation that you're discussing is not one I've heard before. So it would be really helpful for us to talk separately. And I
Sure,
feel like I need to learn.
anytime.
But I do
ha-
want people to know that we're working on, we know
Right.
this benefits thing is a problem, and
Yeah.
expanding the Medicaid buy-in program was a huge first step in eliminating those fears.
But I'll be very happy at another time. We can speak, or I can email you the information.
That would be great. Why don't you email me, and then if I have additional questions, if we could set up some time to chat, that would be
Sure,
helpful.
sure. Thank you very much.
You're welcome.
Thank you. And good to
Yep.
see you again.
Good seeing you.
All right, Rochelle.
Hi. Hi again, Kim. Many families and providers, I think, have a number of specific concerns that affect people with IDD, perhaps even more than people with other disabilities. And one is that the allowed duration of support for people in the workplace, for them to learn their skills and transition to working independently, is often too short. And that becomes a problem if supports are withdrawn prematurely, then the individual is set up for failure. And I was just wondering if this has come under discussion in any of
That
your.
is honestly not something that I've heard a lot about. We talk a lot about making sure that the individuals who need support to make that transition have them, but this is not a complaint that I have heard often. It's probably something that OPWDD hears more than I would. Certainly interested in learning more. Do you know what creates that cutoff? Like, what are the rules for when that?
It depends on the
involved
different
jobs?
programs, whether it's Access VR or OPW's employment support. So it gets complicated, but actually people then become reluctant to even start because they're afraid that
Yeah.
they won't get the help they need in a more durable way.
Very interesting, because like what this public-private work group that I mentioned, one of the main goals of it is to be able to dissect every problem and get down to all of these root causes. Because if we don't understand all of them, then we're kind of just covering things with frosting that, you know, it. So this is another piece of this, that if you have anything that you could send me, it would be very helpful. And have there been conversations with either OPW or Access?
I believe there have. I couldn't tell you specifically for sure, but I'm pretty sure there have.
Okay.
All right, I don't see any other questions in the chat or any other hands, and we are at 10:30, and I know you said you had to go around then.
Yes.
unfortunately. So we definitely appreciate you joining us, and you are welcome back anytime.
Thank you.
Oh, I see. Some people are asking for your email address, if you could put that in the chat.
Absolutely. And if you email me, just mention this meeting so I have the context of what you're talking about, please.
Thank you. And just so you know, Brooklyn is starting up our employment committee. That will be starting in January, so maybe that would be something great for you to come back at some point to hear
Absolutely.
conversations with or do a presentation for.
Yeah, actually, I'm almost more interested in listening to you than talking at you. So if there are more discussions that you're going to have based around the problems, those are helpful. And if I can't make it, I could send someone from my team, because by then, hopefully, fingers crossed, I'll be fully staffed. The SOS group that I know some of you guys were a part of, I missed those. They were some of my hardest meetings, but some of the most educational for me, because I don't have the background in IDD as much as physical and sensory. So it's really helpful for me to hear these things. So feel free to let us know when you have any type of venue that either you need us to come talk about something, or it could be more of a learning experience for us.
All right, great. Thank you so much, Kim.
Thank you.
Again, that was Kim Hill. She is New York State's first Chief Disability Officer. Very knowledgeable, great resource. And she provided her email, so I'm sure she'd love to hear from some of you guys, as long as it's relevant.
Absolutely. And everybody have a very happy holiday if I don't talk to you, and hopefully I will see you all soon.
Thank you so much.
Take care.
All right, that was great. Now we'll get back to our normal agenda. I know OPW had a conflict, so they may not be able to do their update. I think Lucy said she would be back after 11. So I will get back to normal order. Some
I think
Brooklyn.
Lucy's here. Lucy's here.
Nina's the one.
Oh, I'm sorry. That's what I meant. I was looking at Lucy's picture. Nina had called me earlier. She had a conflict. She's going to come back after 11 to do the OPW update. So really quickly, I'll just do a couple of Brooklyn Council news and updates. So I don't believe she's on, but I'm happy to announce that Marjorie Anton from Birch is our new provider vice chair. She had been co-chairing and will remain the co-chair of the Children's Services Committee. And she had agreed to step up when we had an opening in our provider vice chair position. So I'm very happy about that. And while talking about the Children's Services Committee, I know she is on. Trudy Pines from AHRC is going to be joining Marjorie as the co-chair of the Children's Services Committee. I believe I saw. Oh, okay, there she goes. Hi, Trudy, and we appreciate your support with that committee, and I know everyone will appreciate your knowledge and experience you bring with that. And some other good updates, Lucina Clark, who I know is on. She is the co-founder and executive director of My Time Inc., and she has graciously offered her time to co-chair the legislative committee. And I know Lucina is excited about that and brings a ton of resources and knowledge, specifically working with
Thank you.
families, but within our system and elected officials. And we are hopefully going to be having a co-chair for her as well. There's a couple of conversations that need to take place, hopefully this week, and we'll be able to get that solidified. I believe we announced it last month, but just in case, after the new year, we're going to be restarting our Employment Services Committee, and that's going to be with Jahida Gonzalez from SUS and Jillian LeBron from Goodwill. And I know they're excited about kicking that off after the new year. And their first meeting coming up is January 9th from 3 to 4 p.m. As soon as Zoom links are available, they'll be posted on our website. And lastly, the one committee that we're still looking for co-chairs, if anyone is interested, is the Residential and Housing Committee. So please reach out to myself, Rochelle, or Marjorie if you are interested in co-chairing the Residential and Housing Committee. Rochelle, any other updates on council's end?
Not for me. Thanks. You've said it all.
All right. So then I will pass it off to Richard Bosch from IAC.
Hi, Brian. Thanks a lot. Just a few things. The first one to start with thanking everyone from the Brooklyn Council who participated in the rally up at the Capitol building on November 15th. It was a great crowd, good response. It was in the war room, and they got some TV coverage and some press coverage on that. So we'll keep those rallies up. There's another one scheduled for February 12th. We'll get the details on that out, and then there'll be another one in March as we get closer to the finalization of the budget. We'll also be gearing up soon. Usually we start in late December at IAC organizing our lobbying days. I believe this year we will be in person, and we're encouraging the DD councils. We'll be meeting with Brian and the other four to talk about lobbying with your legislator locally. The local outreach is very helpful, especially from the families. Nothing works better than the families meeting with the legislator, telling your story and telling what's so important and what's needed. So I don't forget, there's a letter that Brian put in the chat. It was posted.
I will re-chat it, repost it, because I know a lot of messages have come through.
Yeah, but that's a letter we want families and others to give to their local official or their elected official in Albany to send to the governor. And the primary purpose is asking the governor to put in her executive budget support for funding for DSPs. And we also want we want her to incorporate the creation of a direct support wage enhancement that was in last year, but it didn't make the final cut. But that equates to about a $2 an hour increase, an ongoing annual increase that goes to the agencies and then to the DSPs. And we're also asking for a 3.2% cost of living adjustment, which is the CPI index. The important thing now is that you want the governor to put it in her executive budget. Because usually if it's in the executive budget, it will get passed. The things that come later, it's a harder lift, especially this year as the economy is not thriving for government right now. So get that letter off of the link there and get it to your legislator. Oh, and on that letter, you can feel free to edit it to make it more personal any way you want to. Just keeping the main focus of the letter. So talk about people you know, talk about your family members. But the main thing is to get that point through to the governor to get it into her executive budget. Just on the education front, I'll quickly mention, I don't know how many people are on the call today that are involved in the special education world. But there's always a number of issues. I mean, state ed has taken an aggressive and positive approach at changing the rate methodology and getting funding increases for our chapter 4410 and 853 schools. Those are the special education schools. And the big concern is last year, the Board of Ed created an enhanced preschool program, which expanded the number of hours. We're able to give staff increased funding, increased salaries, but it was all paid for through COVID funding. And now that COVID funding is not going to be there anymore. So there's a big fear that salaries will have to be cut, hours will have to be reduced, and this is really impacting on families as well as on the children. So IAC's Chris Trieber is part of what's called the Emergency Coalition to Save Education Programs in New York City. You'll be hearing more about that. I'll see if I can get Chris to come next month to talk about it. But it's a very important initiative. I mean, across the city, we have, I don't know if anyone from the city department is here today, but you know, the mayor announced a 5% cut effective immediately to all the programs. We're not sure which programs will be cut, but it's hard to sustain anymore in the IDD field and the education field. Just back to state ed quickly, they are working on revising the rate methodology. It's kind of a long-term, several-year process, but we've been waiting about 20 years for it. So the main thing I would encourage you to come to the IAC's education committee, and you can find out that committee plus all the other trainings on the IAC website. That's iacny.org, and go to the header that says events. That has all the committee meetings, and it also has all the upcoming trainings. And that's a good segue into, we have a special training coming up geared to anyone who's an advocate, and especially families. And it's on December 6th at 11 o'clock. And those of you who have been around a little while remember Gary Schulman, and he's back doing one of his, you know, fantastic, energetic trainings. So that'll be a good one. I hope to watch it. And family members, thanks to a very generous family out there, family members can attend that training for free. They could also pay for it if they want. They're able, but if you're not, we do have a generous family who's created a scholarship fund where people can go for free. If you want to take advantage of the free or discounted trainings, send an email to our training coordinator, and it's Jenny. I'll put it in the chat. JENNIE at iacny.org. Do it now or I'll forget. And I know this is something families have been asking for over the years. Can families get a discount in the training, or some attend for free? And again, thank you to family that you beat me to it, Brian. So just email Jenny. Don't call IAC because it's our phone system's a little weird right now, and to be more effective, just email Jenny directly. And there's other trainings coming up, and again on that link that says events has all our committees and our upcoming trainings. Now, trainings are open to members and non-members, slightly higher price for non-members, and the committee meetings are open to IAC members only. So if you're not a member, there is a heading on our website, the Join IAC, and I'll get an email as well as Jenny, and we'll be in touch with you to talk about what you need to know, what's involved, what the cost would be. But we'd love to talk to you, and our membership keeps growing as things get more and more interesting. So I think that's all I really wanted to share today. Get that letter out to the governor, and look forward to information coming up about our lobby days in Albany, and virtual and local. If anybody has any good questions, I'm here.
Not for the bad ones.
Okay, no bad ones.
Does anyone have any questions for Richard? Chris, go ahead.
I have a question, Richard.
I knew you
as
would.
Well, I'm going to have a question every time because there is one question that I don't hear from IAC this much. Are you aware about this rally going on tomorrow at 6 o'clock at Baruch College to shut down some hospitals in the lower part of Manhattan? Because a lot of the disability groups, and just for the record, everyone, I did already send that to Kim, and she's already aware of that upstate. But this is a downstate concern. A lot of the families who uses the hospital on First Avenue, that used to be called different names. So I'm just going to say the hospital with all the names on 16th Street and First Avenue. Since they're shutting down and they're telling people, oh, you got to go uptown. No, you got to go to Brooklyn. No, you got to go to Queens. They're not really working with disabilities. And there's a lot of disability groups are attending this. And I have not heard from anything from IAC. I did hear from Manhattan DD Council and the Advisory Council. And I know Brooklyn Advisory Council has been aware of this too already. And Brian, I did send you that information last night. What is the role for IAC dealing with these hospitals? Because a lot of our individuals who do go to see their doctors, or was comfortable to see their doctors, what are we doing about that?
Well, Winnie might be aware of it. I'm not, but I will say with our limited resources, we have to focus on the IDD world, and hospitals have their own trade association, and we're in communication with them. But I'll check in with Winnie. If there's anything you want to send us,
I already did.
Send to Winnie to do that.
Mm-hmm. But just to be clear, it's not just, it is related to DD world. So we need to be it's very clear it is related to the DD world, because we do have families who do use services and go to those doctors for a reason, because not just a lot of the doctors they go to, it's related to eyes, specialist eyes, dental, as well as other procedures they like to do. So this does relate it to all types of disabilities. So let's not be leaving out. It is DD world. It does affect, and it will strain us to deal with this, because if we have to go to another hospital and that place is overcrowded, it will traumatize a lot of individuals in the low function division. And this is something that needs to be brought up and to be attention to. Thank you.
Okay, Chris, and what hospital was it again?
I'm gonna say it's used to be. It has
New York Eye and Ear is being shut down. And that is serious, because they have the specialty divisions for our individuals with visual, ears, throat, and they had staff there that was trained and knew how to work. That means Manhattan Eye and Ear, as well as SUNY College Optometry and the NYU Dental. Everyone's going to be overcrowded now because they're closing them down. A very serious and sad thing. Very bad.
Okay, yeah, thank you. That's not good
You're welcome.
news.
It's,
I would
it
also, I would
affects-
also add that, Richard, that Beth Israel, Mount Sinai Beth Israel is
Thank you, Rochelle. That was the one I was trying to say.
is being closed. Mount Sinai has decided to close that site and all remaining inpatient beds there, just so to add to the issue.
Okay. Thank you.
Thank you,
Thank you,
Rochelle.
Rochelle, because I do know families who have children, they live in the Coopertown right across the street. And I've heard their complaints too, because I have friends who use that hospital and they told me how upset those families are. So even though you may not think it's related, but a lot of times our families take their children to these hospitals, not because they don't want to go to the DD clinics, but if they're overcrowded, they have to take them wherever they can.
Yeah, well, I remember, as you I'm sure do, is back in the early days of our industry, finding clinical and medical and dental services was very difficult. And the field worked really hard. I mean, remember IBR used to have what was it called, the fellows program, training doctors. And so, yeah, that's very disturbing, because I know our Article 16 clinics have been undercut with the funding, and government doesn't see it as important as they used to. And you can't just go to the community doctor. They still don't have the specialty. So thank you for bringing it up. I wasn't aware of it. I'll bring it back to Winnie and the rest of IAC. Thank you.
You're welcome.
All right, Rochelle's hands up.
Yes, it is on a different matter. I want to thank IAC and NIDA for developing that letter to the governor about our workforce crisis, and also the need for funding for DSP, wage increase, and the COLA. I'm just wondering, I know the strategy appears to be to ask our local legislators to send it, which I think is a really good idea. But should we also be asking families and individuals to be sending this letter to the governor?
Absolutely.
Okay.
That's why you can modify it any way you want. I think it's kind of a long letter, so you can trim it as you want.
This one, yes.
Put your story in there. Absolutely. You got to get it there before the holidays coming up, which means in the next 2 to 3 weeks, you want to get it on her desk, and we're doing everything we can to get the governor's attention. And she has been very supportive, but that executive budget is the most important item that we're working on now.
Okay.
Thanks for bringing it up, Rochelle. It's, again, yeah, families, absolutely.
And Richard, I think that letter, along with the SOS Call the Governor campaign, I think between the both of them, just flooding her physical mail, flooding her voicemail, I think that's all going to help.
Yeah.
For fight this battle.
Okay.
Any other
And
questions for
Nina's
Richard?
back. She'll also fight for it, right, Nina?
Absolutely.
Yeah. Thank
Even
you.
though I missed your presentation, Richard, so I'm sorry.
All
So is
right.
that a
Well,
good
thank you,
introduction?
Richard.
Is that a good segue?
That's perfect.
Right?
Good segue.
All right. Thanks.
All right. And thank you, Nina, for coming back. And sorry we couldn't get you on sooner.
So am I gonna go next?
You sure can if it works for you.
Okay, thank you. Thank you so much. We have a couple of updates from OPWDD, and I'm happy I was able to hear a portion of Kimberly's presentation on employability and the work that is being done with OPWDD. So I'm gonna to kick off with the updates on strategic plan. right? So OPWDD, we continue to do the work on strategic planning. As you remember, last November, we have released our plan on how OPWDD will be advancing supports and services, policies and operations for the next 5 years. And right now, we are finalizing our 2023 annual report, which will be released shortly, and it will incorporate all the feedback we have received from our summer forums. The report will be available on our website, and it will include a plain language and translated versions. We will provide an update on the key activities that OPWDD has been engaged in since the release of the plan last November. And we will speak about the progress that we made on our goals and objectives. We will also include an overview of stakeholder engagement activities from summer 2023. So that's for strategic planning. Moving to public health, unwinding of public health emergency on November 8th, we provided further guidance to address the changes in service provision associated with the ending of the public health emergency. And on November 8th, we have released 4 administrative memorandums. The ADMs will provide the updates on the previous guidance related to the provision of remote home and community-based services, community habilitation, and group dehabilitation services. The new ADM include community habilitation in residence requirements. This is provisions to the ADM 21 ADM 02. We also made revisions to the remote delivery of HCBS. The third one is revisions to the ADM community habilitation, the residential service documentation requirements. And the last one was the ADM for group dehabilitation service documentation. And all this information is posted on our website. The ADM, the updates were released on November 8th. And right now we have 30 days public comment. So service providers are encouraged to provide comments to our counsel's office by December 8th. If someone wants to provide some feedback on the ADMs, I can share the email in the chat. It's the email will go to Regulatory Affairs Unit. If there's something significant that needs to be addressed in the ADM. So my next update would be on self-direction program evaluation, CCO program evaluation, and managed care. There was a question last month in this meeting about the timeline of CCO evaluation. And as you know, on August 15, we have announced that American Institute of Research will be working on evaluating the effectiveness of care coordination practices. And American Institute of Research, they were selected based on the extensive experience of conducting similar program evaluations with other federal and state agencies. Right now, they are working on the project plan similar to the one that we had with the managed care group, and there will be external stakeholder forums held to discuss the project and the progress. The timeline for the CCO evaluation is 15 months from the date the contract is signed. So right now they are in the first phase of planning, putting together the evaluation plan and timeline. So hopefully we will have some progress reports soon. With the managed care, we also have some progress to date that was reported by the Guidehouse, who are working on evaluation of the managed care. They have completed their first reports and started the data review and stakeholder engagement. They have completed interviews with national experts, with the state staff. They worked with the OPWDD central office, and the final report will be issued in February 2024. So that is for the managed care. And I want to expand a little bit on that employability pledge program that Kimberly mentioned earlier, that OPWDD worked together. Let me take it back. Assembly member Chris Burdock and Senator John Mannion proposed the legislation for OPWDD to provide education and resources to assist New York State businesses with hiring, training, and retaining employees with disabilities. And Governor Hochul signed the legislation into law last year. In September of this year, OPWDD and partners introduced a new training that is titled Employability for Businesses. Employability trainings were hosted by OPWDD in partnership with Adult Career and Continuing Education Services, Vocational Rehabilitation, and New York State Industries for the Disabled. And the training covered important topics. And then this is something I think that Deborah mentioned: benefits of hiring people with disabilities, tax credits, strategies to hire and support employees with disabilities, reasonable accommodations, website accessibility, workplace inclusion, disability sensitivity, and supply chain and diversity. The trainings were offered to businesses who previously signed on who signed OPWDD employability pledge located on OPWDD website. And in October, the trainings were opened to all businesses in New York State. To date, we had 144 businesses that have attended the trainings. And at OPWDD, we continue to work on developing an online training available to businesses with additional resources on the website that can be completed at their own pace. And we continue to work to partner with other agencies to get the word out for businesses that hiring people with disabilities is a good business. And if you have any questions about the training, we have our email is employability@opwdd.newyork.gov. So the questions can go there. And the last thing I'm going to mention that on November 1st, we have issued a final regulation governing eligibility for the home and community-based services waiver, and regulation, the changes under Title 14, 635-10.3 section. And that is it for me for today. Any questions?
Thank you, Nina. I have one question. Do you or maybe Angela know the timeline for the family guide?
For the family guide, we have the family guide put together. It's I think it's for right now. It's for different boroughs. We have a separate guide, so we can share that information. And it's being. I know that the guide is being offered in front door trainings.
Okay, great. Yeah, if you can share it with us so we can get it out to the mailing list, I think a lot of the families would benefit from that.
Mm-hmm. Okay, sounds good.
Sorry, Nina. I apologize. This is Angela. The new guide is 99.9% completed. We're just kind of reviewing it now, just to make sure we have everything. So you should be able to get it shortly.
Excellent. Thank you, Angela.
You're welcome.
All right, Chris, you have a question?
Yes, Nina, this first of all, good morning. I just put something in the chat to you because I don't know if everyone else is putting in the chat. Don't worry, Brian. Don't kill yourself, Brian. Any of that new information you have, can you please make sure you send it to us so we can add it to the website, so even Brian can put it on his website, so we can make sure that families and all the agencies, including our Brooklyn Public Library, wherever she is right now, to make sure that information is going out as well. And that's all I have to say right now. Thank you.
Thank you, Chris. Will do.
Debbie?
Thank you, Brian. Nina, it's good to hear from you too, and good to see Lucy and Angela. I just want you to know the reason I brought up to Kim before about the parents understanding the benefits, because if we put our children to work, which is not, I'm not saying it's a terrible thing, but you have to know how to report it to Social Security, because when you don't, it gets very messy and it really affects everybody. So that's why I brought it up. It's much better now than it used to be, and I wasn't the only parent whose child was affected, but I just want to make sure that no parent and individual ever has to go through what many of the families, and a lot of us are on the statewide committee who went through this. So I'm just informing you why I brought that up to her, because it does affect people very badly, and people don't always want to understand. And yes, and as soon as you get your Brooklyn, for Brooklyn, please let us know. We'd appreciate it. We have been asked repeatedly, and we tell everyone we're just waiting for the Brooklyn, the DDRO staff to finish and approve it. And then once we get it, we will send it out and put it on the website. So thank you.
All right. Any other questions for Nina? All right, Nina, I don't see any, so I believe you're off the hook.
All right, thank you.
Thank you for your report. Next on our agenda, committee updates. If any of our Brooklyn DD Council committee chairs are here and have any updates or want to plug any of their committees. All right, Deborah, go ahead.
Okay, I'm the co-chair with Rose Saul in reference to the parent, provider, information, and also care managers. Our last meeting was on November 8th, and we thank very much that we had, wait, make sure I wrote it right. Sorry, we had, okay, it was, I said it correctly, and we thank Care Design for reporting what they did. They explained what their program was and how they sign up families. Our next one will be on the second Wednesday of December. That should be December 6th, and ACA also will be reporting. The reason we're asking each month for the different care managing agencies to bring up and explain is we still get the parents, and even I get professionals who are not in that area. They ask a lot of questions. So instead of us answering it, Rose and I are working together to spread the information. Everybody is welcome, whether you're a parent, professional, elected official, everybody. So we all hope to see you next month. We start at 10. It will be done through Ring Central. Thank you.
Thank you, Debbie. Any other updates from any of our committee co-chairs?
Brian, can I introduce myself? I don't think Jillian's on.
Of course.
So hi, everyone. My name is Jahaida Gonzalez. I work for SUS, and I'll be the new, along with Jillian LeBron, will be the new co-chairs for the employment. So we're looking forward to working with everyone and kind of getting the committee off the ground. We hope to meet in the evenings 2 times a year, because we want to incorporate people that work a day shift. And we also are having our meetings a little later in the day, because again, we want to incorporate more people that are working and have different shifts. So we're excited, and thanks for having us.
Thank you, Jahaida.
Hi, Brian. Can I just say something?
Of course. Go ahead, Lucina.
Hi, good morning, everyone. My name is Lucina Clark. I'm the Executive Director and co-founder of MyTime Inc., our parent support organization. I just want to say thank you for giving me this opportunity, because I believe that, everyone has a voice, and as the parents, we are the voices for your individual with a disability. And being a part of this legislation is really getting our officials to be accountable and really listen to the voices of the family. So I look forward to working in this committee and doing the best I can so all your voices will be heard. So thank you.
Thank you, Lucina. Okay. Do we have anyone here from NYC DOH? I'm not aware that they've appointed a new person to attend these meetings. I haven't
Brian,
seen
this is-
anyone.
Brian, according to what I did check, and I just got the answer, they have not appointed anyone at this time. They're still working on it. There's some issues going on.
Yeah, I know they've gone through some staffing changes, and when Gavin Myers left, they're still waiting to find his replacement to attend our meeting. So hopefully soon in one of our upcoming meetings, we'll have a representative to give updates from the city. And if there's no other committee updates, then we can move on to announcements.
Brian, you
Uh,
forgot the advisory council and MTA as well.
Yes, Brian.
I didn't forget anyone. I asked for committee update. Well, I know
Oh,
MTA
I'm
is
a
not a
separate,
committee.
I'm not a committee, I'm a separate council. So good morning, everyone. I just want to make this, I'll make this very quick as chair of the advisory and the Brooklyn representative statewide. This Thursday at 11 a.m. There will be the statewide meeting. I will be meeting in Manhattan at the Center for Family Support. There is also on our website a link for anybody to go in to join. We do have a public session if you have any issues that you want to bring up, whether it's about the ADM for reimbursement or any other issue, please let them know. They do listen. They do want to hear from their public. Now, our last meeting was on November 21st, and I have to really thank Jennifer Scholl, who's the Director of Disability Affairs from HRA with Elizabeth. They did a fantastic presentation to explain to us how we file for different services through HRA, how to do a fair hearing. That reminded everyone, you must make copies of all reports or any paperwork you send. She did send us the PowerPoint that was at the meeting. It should be on our website if it's not now. Now in December, because it's coming up to Christmas, we've agreed to do a joint meeting, but it will be done through Zoom with the Brooklyn DD Council. The next time we will be meeting will be on January 12th. We're going to do a DD Council resource fair for transportation, but I'm going to let Christopher finish explaining that council. And we hope it'll be in person, and we hope everybody can come and attend. Christopher, finish that, please.
And I'm also going to say Carrie's going to vouch with me also because since it's also related to the Brooklyn Public Library.
And I apologize for not thanking you, Carrie, for all your help and assistance. Thank you.
Yes. And she's saying you're welcome in the mute mode. Just so everyone know that normally we do a resource fair for all the agencies, but this one is due to the fact that we need everyone to really get your families, your individuals, and yes, staffs who are here and seniors and people with disability needs to sign up for the Omni account plus the Omni card. We will have MTA reduced fare there, MTA accessibility, Accessoride will be joining with us, and the Transit Museum, and more surprises, much more. And I will say this will be a good opportunity. Please come. And I remind agencies, you don't have to grab the whole world to go with you, but a staff can be coming, 1 or 2 or 3, I don't care. But we do want to make sure that the information is gone out and shared, because remember, you do have individuals in a group home or home on your own. You should let them know if they cannot attend, but a staff can also learn this too. And as again I said, this will be, and I'm glad somebody's writing the agency's name, which is the address is there too, but this will be at the Brooklyn Heights Library, a new state-of-the-art library, which will be, as I said again, it will be on January 12th from 11 to 1. Carrie, you want to add anything?
Check it out. It's going to be a lot of fun. And we are down in the basement. There is an elevator. So no worries there. And we will have a separate room upstairs where the connectivity is better so that people can actually sign up online for Reduced Fare Omni. I think that's it. Look forward to seeing you there.
Yes, and the information, I did put this on the chat. It is also available on our website. So everyone, please pass the word. And let's get started. And they will be at a lot of these events. They will be at our resource fairs. We do have one coming up January 29th, which I will announce that next month. As a reminder to agencies, if you did not, the ones who I did put in, does not put the deadline by this Thursday, I will put those agencies who are waiting on the waiting list. Some of you who already responded, which I can say thank you, Chairperson Brian, who did respond. But I am going to remind agencies, I will get back to you. I have not forgotten. So, Brian, can I do the MTA report?
Excuse me, Christopher, one
Yes.
moment.
Sure.
Just want everybody who didn't hear, this is the meeting on Thursday is the statewide Family Support Service Advisory Council meeting from 11 to 2. I know on Tuesday, the full Developmental Disability Advisory Council for the statewide is going to be meeting from 11 to 2, and our information is on the Brooklyn Advisory Council's website as well as OPWDD's website. Thank you. I appreciate your
Thank you, Debbie. Chris, you can give the MTA report.
Good morning, everyone. As I already put this out on email, just so everyone know that we did open another train station. As you may saw me at the last advisory council meeting. Yes, I was at 7th Avenue Station. As you know, that's the 7th elevator that was open. So anyone who lives in Park Slope now can get off at 7th Avenue, 9th Street to go there, and can also go to Methodist Hospital or go to Park Slope Library, which I know Carrie is thrilled because I already saw her already putting her hands up with Storm already. But this will be another station. It's open. It is clean and does have signs to direct you how to enter the station. The station is ADA accessible. And yes, a wheelchair can get on or off the F train or the G train like a rocket. Other things we also like to report is the new Omni vending machines are now available in the boroughs. Not all of them have it. So if you're in Brooklyn, and I'm going to mention Brooklyn, it will be at the Atlantic Avenue Barclay Center Station. It will be one at the Barclay entrance and one on the Pacific side. So if you're coming on the D, the N, the R, you will see that machine going towards the elevator there. Please note there are more stations will be added in, but there are a longer list. I did send that to Brian, so he will send that out. And to remind you, when you do get a new Omni card there, the vending machine's the same price as getting a new Metro card, $1 to add additional whatever fare you want. But I'll remind you, you still need to make sure that card is linked to your account so you don't have any issues if the card gets lost, stolen, which is very hard to break because that card is the same as a regular credit card. Lasts 7 years and it will work. Also, I did send out with Brian also the newsletter from the MTA Accessibility. Does have all information, especially you will see the boarding area, a little more stations in the boroughs that are doing the next phase of where the boarding signs are located on the floor. Please put your comments in to send it to any questions you have about those. Doesn't matter which borough is it in, you can still put this concern into accessibility at mtahq.org. Now, people who have complaints, you should be going to the MTA, My MTA website to put any complaints, comments, or once in a blue moon, a compliment. Please make sure you go into the My MTA customer feedback. All this information is with Brian, and I did email him. And just to remind everyone, beginning this Saturday, on the month of Saturdays of December, the holiday train will be running. The old 1932 to 1977 train will be running from 2nd Avenue, Houston to 145th Street. Now, please note that these trains will run. You will see on the sign of the time clock that will say D train to 145 or 2nd Avenue housing. So please be aware that all this is on the report I sent to Brian. And that's all I have right now. I know Carrie has a question, Brian.
Carrie's shaking her head no.
Oh, because her hand is
I think
up.
she's trying to get first in line for announcements.
Oh, yeah. If you have any questions or any concern, I just note that the MTA board is meeting, their committee meetings are meeting this Wednesday. So if you're planning to attend that, that will be this Wednesday. You can also watch it or register online. That is on the MTA's website, which I know I put this on Facebook, but if you want to attend those in person, you can always go there or do it virtual. The full MTA board will be on December 6th. So please stay tuned for all those. Thank you.
Thank you, Chris. All right, I don't see any questions, so we can move on to announcements. So please also, aside from making your announcements on the meeting, please put them in the chat. I see some of you have already, but you know, the chat and the meeting recordings get posted on our website, usually by a day or two after the meetings. So you can find all the information there. So we can go ahead with Carrie.
Hi, thank you. It's more fun trying to get first when you're in person because then you got to jockey with all those people in line. How long am I standing? Anyway, hi everyone and happy Monday. We've got a bunch of things going on in the library. I've put them in the chat. Chris has put them in the chat. Thank you. But I wanted to focus on the IEP meeting overview workshop. The next workshop, which is an overview of the IEP. I'm still like on break time here. And Include NYC is presenting it for us. It's basically an introduction or a refresher on what the IEP is, on the process of getting one, what happens when there's a problem, all those different things. It's a really basic and important workshop, and things change from year to year. So it's worth mentioning to families and things like that, especially if they are families new to the special education process. This will be in person at the Brooklyn Public Library at our central library at 10 Grand Army Plaza. And unfortunately, it will happen 10 days after the Jay-Z exhibit goes down. So we're not offering a double header here, but we are offering this workshop, and the information is in the chat. I will put my contact information in chat. And look out for our other events too, coming up in December and January. We've got some exciting things. And please share with parents. Thank you all.
Thank you, Carrie. All right, next we have Doris.
Morning, everyone. My name is Doris Kahn, and I'm the Outreach Coordinator for New York State Institute on Disability. New York State Institute on Disability provides the following services. We provide evaluations to obtain OPWDD eligibility for individuals who do not have Medicaid and reside in the boroughs of Brooklyn, Bronx, Staten Island, and Queens. For information, contact Elizabeth Sunshine at 917-699-0578. NYSID also provides crisis management services to families who live in the Bronx, Brooklyn, and Queens, and you can contact Juliet Hawkins at 917-524-4856. NYSID also provides reimbursement for goods and services in all 5 boroughs. And for information, you could contact Jackie Tripodi at 929-202-1115. Holiday is coming, kids are off from school, and NYSID provides recreation outings for individuals and their families residing in the Bronx, Brooklyn, Queens, and Staten Island. We do not provide recreation outings to individuals with self-direction services or who reside in Manhattan. You can contact Sarah Alton at 718-494-6457 for more information of what we have tickets for and application process. We provide transportation to these outings. In addition, we provide transportation for medical appointments, but if you're going to one of these outings, we provide transportation services for individuals living in Brooklyn, Bronx, and Staten Island. And to contact John O'Grady at 917-747-9424. I put all this information in the chat. Thank you, Brian.
Thank you, Doris. Next up, we have Sandy.
Hi, everybody. I'm Sandy Naper from Adapt Community Network. I'm on the Family Connect team, and we have 3 exciting free workshops coming up. The first one is on November 30th from 10 a.m. to 11:30 a.m. It's called The Roadmap to Obtaining Eligibility for Support and Services for Your Family. And Kate Gottlieb from ADAPT will be doing the presentation. The next one coming up is on December 7th from 10 a.m. to 11:30 a.m. And that's going to be Special Education Mediation, Resolving Disputes Between Parents and Schools. And Carol Times and Hannah Resnick from the Peace Institute will be our speakers. And the last one will be on December 11th from 10 a.m. till 12 p.m. It's going to be CPSE to CSE, Transition from Preschool to School Age Special Education Services. And we will be partnering with Include NYC for that. Our registration is required for every webinar that we have, and the registration links are in the chat, and information on all of the things that I just announced are also on the chat. And one other thing, we also provide Spanish and Mandarin translation for all our webinars. Thanks, everyone.
Thank you, Sandy. Jay Kleiman.
Good morning, Jay Kleiman from LifeSpire here. We have in Brooklyn crisis intervention, through which we offer referral and linkage, advocacy, short-term case management, that type of stuff. In the other boroughs in Manhattan, we have behavior management, parent training program, as well as Queens. We have that program in Queens as well. Okay, so I put my contact information in the chat. If any questions, feel free to reach out. Thanks.
Thank you, Jay.
Yep.
Any other announcements from any agencies or any other groups? All right, I don't see any other hands. I don't see anything in the chat. I will say I just got the email from Nina with the FSS guides. So I forwarded those out and I will put them on the website. And as a reminder, our next 2 upcoming meetings, our December meeting is the 18th at 10, and we will be having a presentation by Suzanne McDermott from CUNY Steps 2 program. I know they had talked about it at last month's meeting, and they've been out and about at all the fairs. So Suzanne will be doing a full presentation on the CUNY Steps 2 program. And in January, our meeting is January 22nd, and we'll be having a presentation by Paula Martinez-Boone from New York Public Lawyers on future planning. So again, you can visit our website, bkddcouncil.org, where there's a calendar and links to the meetings with the logins, and also watch our website for any updates and breaking information. If there's nothing else from anyone, then you guys will get back a half hour.
I agree, Brian. Make a motion to adjourn.
And I'll second it. Thanks, Brian.
I don't know if we needed that, but thanks.
Just in case, just in case.
And I'm just having a little fun. Just having fun, because you can say the meeting ended exactly 11:30 on the nose.
That's right. All right.
But we want to say, I want to say thank you to Rochelle and Brian. An excellent presentation with the chief accessibility.
Well, the only person to thank for that is Kim Hill.
Yes,
Well,
but
we
but
will.
we will, but guess what? You two are here, so I can say thank you to both. See, I got backup.
All right.
Yes.
All right. Thank you,
Okay.
everyone. Have a
Bye.
great
Thank you. Have a good day.
month. See you in a couple weeks.
Okay.
Bye. Thank you.
Bye.
Take
Bye.
care. Bye.
Bye. Bye. Bye.